Can I come in? Hi, I'm Miranda. I'm going to be your nurse today. How are you doing? Yeah? Do you care to tell me your name and date of birth? All right. Just the man I'm looking for. They put an order in, the doctor, for us to put a Foley catheter in. Have you had one of those before? So it's just a little tube that we're going to put through your penis up into your bladder. It's going to help your bladder to drain so you don't have to use that urinal or get up and go pee. We just have you on so many medications that make you lightheaded and dizzy, and we really want to track your urine, how much you have out, very carefully and closely. And so this catheter will help us do that. Okay? Perfect. Are you allergic to anything? You're not allergic to latex or betadine? Okay, perfect. All right, well, if you don't mind, I got some students here with me today, and I was going to let them come in if you don't care. And I was going to kind of explain this procedure as I do it. I appreciate that. Thank you. Okay, so if you'll just close the curtain so no one can see. If they do open your door, they won't be able to see what we're doing. I'm going to just get you situated. I got some supplies here with me. I'm going to get your bed raised up so I can get to you without having to bend over. All right, I'm going to pull your blanket down. I turned your heat up a little bit so you wouldn't get too cold. I'm going to put this rail down. Looks like you're up in the bed nice and good. I've got your knees down. Oh, there we go. And I'm going to put your head down a little bit. Can you tolerate that okay? Perfect. Mr. Smith, the first thing I'm going to do is I'm going to put this pad underneath your butt just so I can wash you off with some soap and water, okay? All right. I'm going to uncover you. All right, this is just soap and water. This is so we can get you and make sure you're nice and clean before we put that catheter in. We don't want you to have anything that could potentially cause that catheter to get infected. Okay. Okay. All right. I'm going to just throw this in my trash can. My trash can closer to me. All right. Now the gloves. Let me grab another box of gloves over here. All right. So the next thing I'm going to do is I'm just going to set all my stuff up. So I brought 2 pairs of sterile gloves with me. This is just so that if I were to contaminate a pair, I'd have a backup. I do have my catheter kit. Okay. The patient is not allergic to latex or betadine. We've checked our order. I have my trash can down here by my feet, just in case I need it. I'm going to place the patient in a particular position depending on if they're male or female. I'm going to show them how to put a female in first, okay? You care to help me? So for a female patient, you would want them to be dorsal recumbent, which means they're going to be supine with their legs bent and then their feet flat on the bed. So they'll do that for both legs, okay? Now for a male patient, like Mr. Smith, we're going to have them supine with their legs slightly abducted. So laying on their back with their legs spread, okay? I'm going to go ahead and uncover you. And I'm going to open my kit. I'm just going to stick this little bag here in case I need it for trash. I'm going to also have my trash can here. Remember that if I do throw things in this trash can, my hands can't drop below my waist. So it's a better option to have this available. Okay, so So I'm going to go ahead and take my kit and I'm going to place that on the bed. Mr. Smith, I've got this kit here between your legs. This needs to stay completely what we call sterile. So if you can not move or anything, I don't want it to get any bacteria on it, okay? Perfect. All right, so we're going to start by opening it away from us. So there's the little tab. We're going to pull that and open it away. And we're basically just opening everything away from us. Okay, and so away from me, and then the last one is going to be close to me. Now, what I don't want to happen is this can fall back as long as I haven't touched inside of there. Okay, I touched here. If I touch this and then it falls back over my sterile field, okay, then it's contaminated what's in there. So that's why you don't want your drape folding back in. All right, the first thing I have on here are some gloves. I'm not going to use those. I'm going to grab those off. I like to bring my own gloves. The next thing I have is a drape. So I'm going to grab this drape. It's kind of folded where I need to pick it up at. And what I'm going to do is I'm going to kind of open it up. It's not sterile. I'm going to do shiny side towards me. It's a little bit darker blue. And then I'm going to place this under the patient. It's not sterile. I want to make sure that when I'm placing this, that I'm not crossing over my sterile trays there, okay? So I'm just going to kind of put it here and work it under there so it can collect any of the solution I use to clean with. All right, so once I've got that nice and flat, I'm going to make sure I got everything kind of lined up. I've got one more drape on here. I'm going to grab in the middle. This is a fenestrated drape. You can use this and allow the genitalia to just stick through the hole. I'm not going to use this. I find it more difficult. Okay, I'm going to go ahead and take off my regular gloves. At this point, I can go ahead and apply my sterile gloves. Keep in mind that you may not be able to do hand hygiene prior to putting on your sterile gloves. I've already opened my sterile field, and most of our patients' hospital rooms do not have the ability to have hand sanitizer or a sink where I can still view my sterile field. Okay, so I did hand hygiene whenever I entered the room, and that is sufficient. I'm going to go ahead and open my sterile gloves. Just unfold them. And then I'm going to unfold them again. Once I get to here, I'm going to unfold the top flap, the bottom flap, and then I'm going to grab these two flaps and open those. I'm going to do that little tinting where I kind of prevent this glove package from folding back over and contaminating those gloves. Non-dominant hand's going to pick up right in the middle of the cuff of the dominant hand. Right? And then I'm going to step back and I can adjust this cuff. The cuff isn't sterile anymore. And I'm going to fix it and get my hand in there, pulling on the cuff, keeping my hand above my waist. When I put this glove on, I like to take and hold my sterile field in my 1-inch border. I like to turn this glove so that I can mess around with it and get my hand down in there in that cuff the best as possible. While you're picking the glove up and putting it down on your sterile hand, you can touch it with your thumb. Right now, I have not done anything to contaminate the cuff of this glove, so I can touch it with my other sterile hand. Now, once this hand goes towards the cuff, it's no longer sterile. So once this hand is getting ready to go in, your thumb needs to be up. You can't touch the cuff anymore as your hand goes in. So you should have your hitchhiker thumbs up, and we're going to put on our sterile glove, and now both of our hands are sterile. At this point, I'm going to go ahead and kind of work with my kit. So my kit, if you look at it, I have my swabs that I grabbed off, and then I grabbed the tray, and there's two little handles here that I picked it up with. So this is how I'm going to move it. I don't want to touch the sides because now those are no longer sterile, okay? So I'm going to pick it up and I'm going to place it kind of where these two drapes connect so that they stay flat. I'm going to go ahead and open my swabs. So if you're practicing this on one of our mannequins, just make sure that you don't use betadine, which comes in your practice catheter kits on our mannequins. So we're going to make sure that we don't touch anything. I'm going to stick these on my tray. I'm going to go ahead and get my lube. I'm going to put my lube in this long one right here beside of me. Okay. And remember, this drape isn't sterile, so I'm going to go ahead and just lay it on my drape. I'm not going to worry about trying to get it in that trash that's fallen over. Okay, so I've got my swabs, I've got my lube. The next thing I'm going to do is I'm going to go ahead and grab the urine cup out of there. I'm going to put the lid on it, and I'm going to put it to the side. I don't need that right now, and it doesn't need to be sterile later when I need it. The next thing I'm going to do is I'm going to grab my kit. I'm going to take both of my hands and kind of grab it on the inside, applying pressure. And this is how I'm going to move this box around. Okay, so however I decide I want it. Then I'm going to grab the yellow part. The yellow part is the actual catheter, and it has a plastic sleeve on it. I need to remove the plastic sleeve. Okay, and this is something that is often difficult and that you need to practice. So we just want to make sure that we don't contaminate when we are getting that out. And then once you take that off, you can lay it back down in there and put your plastic sleeve to the side. Once my catheter is back down in there and I've got the sleeve off, I'm going to grab my flush. So this is what's going to inflate the balloon that allows the Foley catheter to stay in place. I do not want to inflate the balloon prior to insertion because that can cause problems with the balloon. So this syringe is going to be connected to the green port on your catheter. If you look on that port, it says that our catheter is a 14 French 10 milliliter balloon, which means that it can hold 10 milliliters of fluid, which is what our syringe is. I like to put my syringe back down in there. Then I'm going to grab the yellow part and I'm going to stick it in my lube there. Now, currently the way that my catheter is, it's sitting on the top of the box and going into the tray here, right? So it's sitting on top of the box going into my tray. That's completely fine. We do not want the yellow part to touch the drape. So if you have trouble getting it to stay, you can leave it in here until you're ready to insert it, okay? All right, so that's completely acceptable. The next thing I'm going to do, and this is going to be the thing that I do last, because once I contaminate my hand, I can't unwrap things or fix things with my catheter. I'm going to take my non-dominant hand, and it's going to be my non-sterile hand. And I'm going to grab so we have a male patient. So for a male patient, I'm going to grab the penis, and I'm going to hold it erect or upright at a 90-degree angle. I want to pull it forward or up, apply some tension in order to straighten the urethra. If the patient is circumcised, I want to pull the foreskin down and then pull taut up at that 90 degrees. Okay. This is going to help, again, straighten that urethra and help that catheter to go in better and more easy. The next thing I'm going to do is clean. So I'm going to grab my first swab. For a male patient, we're going to do 3 circular swabs. We're going to start at the urethral meatus, or the top. So swab around so I don't contaminate. Grab my second one, down a little bit further, around. Grab my third one, down a little bit further, and around. Once I've cleaned, then I'm going to go ahead and grab my catheter. So I've already got it in the lube. It's already lubed. And I'm going to grab it in my hand, kind of twist it in there the best I can. I don't want any of the yellow to, at the hub there, that bifurcation where it splits. Anything before that, I don't want it to get contaminated. But at this point, the syringe, the bag, the tubing, it's fine to touch the bed. So I'm going to grab the catheter and I want to insert it into the urethral meatus. I want to ensure that my sterile hand does not touch the urethral meatus. So I'm going to insert the catheter in a male patient until I get urine. Once I get urine, I'm going to advance another 1 to 2 inches. Some hospital policies will say to advance to the hub or the bifurcation, so where your tubing and your green port or your syringe are. Just know what your hospital requires. Once you've got urine output, you're going to take your non-sterile hand and you're going to grab about an inch or so forward on the catheter and hold it and brace it. So you're holding onto the penis and the catheter. You're going to inflate the balloon slowly. If at this point the patient complains of pain, if the balloon is difficult to inflate, you're going to stop, let the balloon deflate, and then where you didn't touch, you can go ahead and try to advance some more. Okay? And then try again to reinflate the balloon. If the patient complains of pain at this time, you're going to go ahead and stop and get help. So stop, deflate the balloon, and remove it and get help. Once you have all of the saline in the balloon, you need to apply positive pressure on the syringe. You can see it keeps popping off. The reason for that is the pressure. So I have to keep pressure on the syringe where it's plunging down as I kind of pull it off and hold the port. Otherwise, the balloon is going to push all the fluid back into the syringe, and there's not going to be enough fluid in our balloon. Okay? So you can see when I stick it on there, it starts to fill back up. So I have to apply that pressure and then take it off. Okay? Once I get that off, I'm going to just slightly pull until I meet resistance, just slightly. Then I'm going to go ahead and put my little label on there. So the bag should be date, time, and initialed. I want to make sure that the bag is on a part of the bed that moves up and down like the frame, but not a part like the bed rail that is movable and separate. Okay, so once I get this on the bed frame, I'm going to go ahead and I'm going to secure the catheter. I want to secure the catheter to preferably the upper thigh on top. We don't want to put it in the inner thigh because the legs can rub together and it can cause skin breakdown. We, of course, don't want it on the medial thigh because it's too far down. There are times where your hospital policy may say to even secure it on the upper thigh or the very lower abdomen. Okay, so we're going to secure that there. So you can secure it with tape, a stat lock, a leg strap. It needs to be secured where that there is slack and it's not pulling on the patient's penis or their vagina. Okay, we don't want a lot of tension to be there. Okay, if I have a female patient, I'm going to clean a little bit differently. For a female patient, I'm still going to have 3 swabs. For a female patient, I'm going to take my hand that it's going to be non-sterile, and I'm going to separate the labia. I want to make sure that the labia doesn't close at any time or that's going to contaminate. So I'm going to hold the labia open, and then I'm going to take my swabs, my 3 swabs, and I'm going to do an inner farther away. I'm going to do closer labia inner, and then I'm going to do the labia right down the middle. Okay, and again, the whole time I want to ensure that it doesn't close because that's going to cause it to contaminate and we would have to start cleaning over again. Again, when you're inserting the catheter with a female, you have to be even more cautious about ensuring that your sterile hand with the catheter does not touch the labia anywhere. All right, so we've got our catheter secured. I saved some wipes from earlier. I am going to go ahead and make sure that I wipe any betadine off of the patient so that they don't end up with a delayed reaction. I'm going to go ahead and clean everything up, and then I'll be sure to document. So for a catheter, I'm going to document the size of the catheter. So I mentioned that our catheter was a 14 French. It says it on your package as well as on the balloon port. So a 14 French Foley catheter inserted using sterile technique, 10 milliliters of saline instilled into balloon. Patient tolerated procedure well. However much urine I got, the color, any, smell, any particles, or if it's clear or cloudy. If I need to get a urine sample, I can do so from the bag if I just inserted the Foley and haven't left the room. If I need to get a sample any other time, then I'm going to have to get it out of this port. So there are two ports. There's your green port, which is your balloon port, and then there's this more clear port on the tubing. This is how we get our sample. So we're going to clean it with an alcohol swab, and we're going to put our syringe in there, and we're going to draw back and try to get urine from the bladder. Okay, and then we would take that and put that into our collection cup. And then again, just make sure that there's no, that the catheter tubing isn't coiled, that the bag is on a part of the bed that moves up and down, but not the side rail. All right, get Mr. Smith here all covered back up and settled. And you can let us know if you need anything. How are you? It's Miranda again. You ready to get that catheter out? You are? Okay, you tell me your name, date of birth. Perfect. I'm gonna get on some gloves. So the coming out part is not as hard as the going in part. Okay, so I got my students back with me today, so they're going to come in if you're okay with that. Perfect. All right, we got the curtain closed. We got all our stuff. So we got some stuff to wipe you off with. We got a pad or a chuck to put under your butt so we don't get you wet, or if some urine leaks out when we take that catheter out. And then I got a syringe because I got to take the saline out of that balloon. And then I got a cup for a urine specimen if I need to get that. Okay? All right, let's get you sitting up a little bit closer to me. All right, perfect. All right, mister, I'm going to uncover you, okay? Okay, looks like we just emptied your catheter bag, so there's nothing in there. We're going to go ahead and stick this underneath you. I'll spread your legs just like we did before. We'll put this under there, that way if some urine leaks out of that catheter when we pull it out, it won't get on your bed. All right, so the first thing I'm going to do is I'm going to go ahead and uncover you, and I'm going to wash you off a little bit. We just want to make sure that no bacteria finds its way in there. We don't want you to get an infection. Has it been bothering you any? Good. All right. Okay, I'm going to go ahead and open my syringe. I looked at when we put it in, and it did say that we put 10 mLs of saline in there, and it looks like that's what it says here on the balloon port. So I'm going to go ahead and stick my syringe on there. And guys, as you can see, it kind of just starts to fill up on its own. We're going to let it fill up as much as it can on its own. Once we get all 10 out, so we got 10, what we're going to do at this point is we're going to try to pinch the tubing, the catheter tubing. What we don't want is the urine from here coming back and spilling out all over him. So we're going to do the pinch it a little bit. We're going to ask you to take a big, nice, deep breath, nice and slow, and it's going to come out nice and easy. All right, perfect. And then we're just going to wrap this up and dispose of it properly. We got you nice and clean. Now, what I want you to do is I want you to make sure that you push your call light over there whenever you feel like you've got to pee. And we're going to give it just a little bit. Sometimes when that catheter is immediately taken out, you do feel the urge to pee, but your bladder right now is completely empty. So I've also put what we call a hat in your toilet in there. If you do end up going in there to pee, we just want to keep track of it to make sure you're peeing enough and that you're peeing well, since we just took that catheter out. I would prefer you push the call light and let me come help you, just at least for the first time. Okay? All right. Well, give you your table back. And you've got your call light. You just let me know if you need anything, Mr. Smith, okay?